I call the member for Hasluck.
Thank you, Deputy Chair. I look as though I'm going to have the same circumstances this morning with you. Deputy Speaker, I rise to support the National Health Amendment Bill, the 5th Community Pharmacy Agreement Initiatives Bill 2011, and I welcome the proposed changes to the Act. Let me assure the member for Blair that it's not a matter of carping or complaining, it's a matter of just having amendments that give us the opportunity to review and reconsider those elements that are extremely strong within this proposed amendment and the changes that will be implemented, but also the opportunity to make adjustments so that we better service the community. Allowing the supply of pharmaceuticals by a pharmacist without a prescription under certain conditions is a constructive initiative and extends point of access for primary health care for those who have a need of those services. And every one of us in our electorates have pockets in which the levels of disadvantage or age or income are factors in the way in which people access or don't access medical services, and in particular GPs. And when you talk to people, they certainly trust their pharmacists, and they're seen as a crucial point at which you can go and seek sound advice on a medical condition, but without the opportunity that you would have with a medical practitioner. But nevertheless, they're still valued. This is particularly relevant to families and individuals who struggle with the increasing cost of living and limited access to a doctor. I want to remind members this change is desired and highly beneficial to Australians living in regional, rural and remote areas of this country, and certainly to the residents of my electorate in Hasluck. I think sometimes we overlook and take for granted that there are avenues of access that are not always consistent across any region, and because of the geographic diversity of this country is also challenging in the way that we keep that continual supply of medicines, and particularly prescribed medicines for those with chronic conditions. The enablement of the supply of pharmaceuticals by a pharmacist is welcomed and ensures compliance with regimes of prescribed treatment. There are some medications that if you stop them suddenly, they have a detrimental effect, and I am pleased that the government has put forward this amendment because it will enable the continuity of compliance, but also the continuity of prevention of the onset of an illness beyond the point of damage, or consistent with a regime of treatment that holds the condition at bay and gives an individual quality of life. It also means that the constituents within my seat will now have better access to important medications that they require to improve or maintain their health status, as opposed to breaking the cycle of continuity of their medication. Eligible pharmaceuticals and the conditions for supply will be determined by the legislative instrument and allows for the supply of and PBS claiming of pharmaceuticals in residential aged care facilities based on a standardised medical chart rather than requiring a doctor to write a separate prescription. This is particularly important given the shortage of general practitioners in doctors in rural and regional Australia, and in some capital cities where the ratio of patients to practitioners is unacceptably high. This is particularly relevant to those residents in the Gosnells area of the seat of Hasluck. The result is there are patients who require medications for a chronic ongoing health condition running out of prescribed medications and then having to wait to see their local medical practitioner. In some areas of my electorate, it can be several days before you can get to see your local doctor. And in this instance, the jeopardisation of the continuity of prescribed medication becomes problematic. The bill enacts initiatives agreed between the Pharmacy Guild and the government in 2010 under the 5th Community Pharmacy Agreement, which includes the continued dispensing initiative, which I again commend the government for, the medical chart initiative, and the technical amendments regarding prescriptions for the supply of pharmaceutical benefits. The strength of the benefits is beneficial ultimately for some of the chronic therapy medicines and allowed continual dispensing. I think some of the concerns that exist, even though the intent of the bill is evident and the Coalition is concerned that the specificity of detail is not in the legislation but conveyed through ministerial statements or upon advice from the department. Having worked as a senior bureaucrat I know that the detail is often left through the regulatory framework that can follow this, or alternatively through guidelines that are established for which the administering pharmacists would provide medications under those guidelines. But nevertheless, it would have been good to have known the detail of the process that would enable the distribution of those pharmaceuticals, and certainly what some of the restrictions may be, if there are any at all. The Australian AMA, or the Australian Medical Association, is strongly opposed to continued dispensing, and I quote, "significant change in the role of pharmacists. This is not in the interests of patients or the working relationship between doctors and pharmacists." Well, I concur with their sentiment. I think nevertheless the intent is that we enable multiple points of access to ongoing supply of prescription and medications required for the medical treatment of any individual. And again, I go back to that point that the trust that exists for pharmacists is extremely high. And to me, it's a good practical way of ensuring that the relationship in both the pharmacist and the medical practitioner is also critical and crucial to the ongoing treatment and case management and the case management plans for patients. Currently, there are mechanisms in place for continued dispensing to occur. The owing prescription protocols, where a pharmacist can supply a PBS medicine after contacting the patient's doctor by phone, and that the script is provided within 7 days. The issues for pharmacists include the administrative difficulty for pharmacists and the financial risk, as PBS claims cannot be made if the script is not provided. Whilst it's a good stopgap measure, I think these new amendments now alleviate that and allow for people to better access that ongoing care that they need without having to worry that the 7-day requirement will not be met because they have been unable to get into their local doctor. And I know within my own seat there are people who have to wait up to 14 days in order to see their local GP. And if they go and get their script, but they're charged for a full consultation. Emergency supply provision under the state and territory regulations allows a 3-day emergency supply of essential medication where it isn't possible for the patient.
Being 7 p.m, I have to interrupt the member for Hasluck, but he will have the opportunity to continue his remarks at a later date.